Thank you very much, Ra. Tēnā koutou katoa, e mihi ki te atua, mo ono manaki. Kua whiwhi ai, tātu katoa. Kia koutou kua tamai, ki tēnei hui, tēnei rā koutou katoa. Welcome to you all. I acknowledge our Creator for his blessings upon us, and to those of you who have travelled to this conference, I welcome you again. So thank you everybody for coming. I'm Edward Coughlan, I'm the current president of the New Zealand Sexual Health Society, and privileged to work with these marvellous people here who frankly have done so much work for this. We have already discussed the sponsors, so I won't go through that, but I would particularly like to thank Catherine Parks and Maureen Cashel, Angela Milner, Terria Stewart, for all their work. People know how much work goes into concerts if you've ever done one, and they have really been working hard. We were worried that we wouldn't get enough people coming, but with a lot of work and also with Nairi and other people working, we managed to get about 180 people coming, hopefully. So it's fantastic. I'd also like to thank Paula from Forum 2.2, who has been working with us to get this off the ground. I'd particularly like to thank all our speakers, and in particular, our keynote speakers, Hannah O'Regan, Richard Tankersley, and David Templeton. Before I do more of a quick bio of David, I'd just like to mention that this is our 100th anniversary. So the Christchurch Sexual Health has been open for over 100 years. And you may have wondered why I brought a black bag onto the podium. These were our original records. And if we go to page 1, on the 11th of January, 1917, our first patient was private parts. It wasn't private parts, it was no. I was going to say his true name, but I decided no, that's not advisable. When the then Minister of Health, Tony Ryle, did come to visit because of the syphilis outbreak, I pulled out this and said, I think it was your grandfather, but... his grandfather was actually a parksman in a garden in the park, which he explained to me, which was very interesting, so it may have been true. So our speaker who's going to open is our keynote speaker, and he comes from Sydney. This is Associate Professor David Templeton. He's a Senior Staff Specialist and Clinical Services Manager at the RPA Sexual Health in Sydney, and holds academic appointments at the Kirby Institute, University of New South Wales and the University of Sydney. And he's been working in sexual health for 20 years, almost 20 years, and has completed his PhD in 2008. And we were just going over it before, and we first met in 1999 at Sydney Sexual Health at the Journal Club. He's been he was involved in some of the early PrEP studies in Sydney, which is very useful to have the experience of Sydney and where they've rolled out this, and it will be fascinating to see this. And it's also been involved in the HPV anal cancer studies, the SPANK study. God, they have great names, don't they? And which he will be telling us about. But tonight he's going to be more of an overview about HPV. He did ask about the protocols. He's going to be the convener at the Canberra Australasian Sexual Health Conference coming up in November, and he did want to know about the protocols. I did explain to him about a hongi and said it's not a Glaswegian kiss, because he comes from Glasgow. So without any further ado, I'd like to welcome Dave to come up and give the opening.